I would say by and large the patients that come in here, they have about 60 to 70% have started with painkillers, Vicodin, Percocet, OxyContin. Painkillers can be a reflex. Someone comes in pain, car accident, agony, whatever. They're going to go right to that, and without suggesting, let's say, physical therapy, acupuncture, which we do here, other modes of treatment, because it is not scientifically proven that that is an effective way to deal with pain.
My doctor had prescribed me 3 Percocets to take a day.
I really had no idea how incredibly addictive these pills were.
Yes, they're very addictive.
I think the reason people switch from painkillers to heroin at such a high rate lately, in the past few years, is because of the unavailability of the painkiller. With the heroin, when you use it intravenously, which a lot of them are doing, it's going to cause a rush.
I had no idea I would ever become a heroin addict just because of being prescribed painkillers.
They are having a hard time getting the pills too. The heroin, they can get faster, easier. They just want whatever's easiest to get.
I'm not even from New York City, and I could find it. I could easily go down within a half hour and find heroin.
It used to be minorities that were heroin addicts mostly, and it was considered a very low-life thing and criminal thing, and people were thrown in jail for long periods of time. Really strict laws in New York, and now it is everyone's waking up. How we treat people that find our center, I meet with them, the counselor meets with them. We take a really in-depth history of their drug use since they started any drugs. The counselor assesses what their point they're at with their recovery, what programs they've gone to before, whether they've attended Alcoholics Anonymous, Narcotics Anonymous, and we'll start the Suboxone, which is under the tongue film, and we start that gradually. It takes about 2 hours. We see how they're doing with it, and we find out their dose, and then they can go home on that dose. Then they'll come back the next week or sooner and meet the counselor. And we strongly encourage them to go to outside program, and we keep track of that. And we check their urine every week, make sure that the right amount is in there and nothing else, because we, no pot, no alcohol, and we really urge them to do the work of recovery while they're on Suboxone, so they can work, they leave feeling better than they felt in years. They feel clear.
I found Dr. Saltzman online. She basically really saved my life,
I found Dr. Saltzman on the internet, and it was the best thing that could have happened to me. I'm very happy that I found this clinic.
Now I feel confident. I'm hopeful for the future.
The patients that are very resistant to going to program, to meeting with our counselor, or going to outside program like Narcotics Anonymous, have a harder time. And I tell them that from the beginning. You have a 50% lower rate of success in long-term recovery when I take away the Suboxone than the person that's going to really engage. People that really engage, they go to meetings, they tell their families, they have the best fighting chance.